COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, transitional housing, and food assistance. COVID-19 recovery.
Hi, I'm Terrence White, Executive Director of Community Action of Greater Indianapolis.
And hello, I'm Kelly Vaughn, and I'm with WHMB TV 40, and I will be joining Terrence White here and co-hosting a new television show here at Channel 40 called COVID-19 Recovery. And I think the title of the show is self-explanatory. We're going to talk about this process of recovering from this horrible, dreadful pandemic. And so we want you to join in and get all the information you need about the recovery process, including vaccinations, and there's so much help out there for people in the community, which comes from Community Action of Greater Indianapolis. I know you provide a lot. Terrence, tell folks what Community Action of Greater Indianapolis is and how you're involved in the community.
Well, Kelly, we are actually a 56-year-old organization with the primary mission of helping people move to levels of self-sufficiency and self-reliance. And so as a result of this pandemic, we have kind of changed our focus a little bit to help people as they start the recovery process. Prevention, preventing transmission, and therefore we obviously can't do it all. So what we have to do is we have to kind of be kind of creative in how we approach the community, in taking our services to the community. So one of the things that we decided to do was we decided to do some sub-awards. And so we sub-awarded over $500,000 to community partners in Hamilton, Hendricks, Boone, and Marion counties. We've offered rental assistance in-house. We've transportation, food supports for the many families out there struggling to take care of their children and families, especially while they were confined within their homes and in isolation. We also do workforce development is another one. There's been so many people in our service areas that have been displaced from their jobs, reduced income as a result of reduction of hours or whatever the case may be. So those are just some of the things that we're doing. So what we're trying to do now is we're trying to focus on financial recovery. What can people do to help themselves recover? Now that the vaccines are out, what are their options now? They can step outside their homes. They can start to put their lives back together.
So you mentioned the words financial recovery. So what's the typical call that you get at Community Action of Greater Indianapolis about a person needing to recover financially? What are they saying?
Well, normally when people first come through our door, they need a direct assistance, whether it's rental assistance or help with their housing, transportation. If they are still working, they may need assistance getting back and forth to work. But those are usually the initial contacts. And as we dig into their issues and assess their situations, what we commonly find is that there are other underlying issues of why they actually need the help. So from there, we usually take a proactive approach and address the issues of every household member, and it could lead to a job placement or a development of a specific skill or whatever to help them be able to transition into a different vocation or skill or trade. But that's normally the initial reason why they come to us.
Because a lot of people have lost their jobs, and some of those jobs, they look like they're not coming back. Or even if it's a restaurant that's open, those restaurants are gone. It's just amazing some of the businesses that have been American institutions, and they're gone.
Right, and not only just the jobs, but also the people's routines of obtaining their educations. you got schools were shut down temporarily and are operating virtually or have a hybrid situation. You got to remember that those is not only just the restaurant entertainment business, but a lot of different jobs or different disciplines have been affected.
Have been impacted. Okay. Now, how quickly, when someone reaches out to Community Action of Greater Indianapolis, how quickly are they able to get the assistance they need?
Well, it depends on what they're actually in need of. Usually, we try to act fast enough before any type of displacement takes place.
Wow.
It may take us to advocate for the client on the with the landlord, or again, or if it's a transportation issue, if their car is broken down and in need of a repair. Those are the types of things that we can take care of pretty quickly.
So you actually assist with repair. So I've got, I don't know, my rotors are bad and I can't drive my car because my brakes have gone out and I can't get to and from work. I have no money to get that repaired. And so I can actually call you for help. How can I qualify? What qualifies me for that assistance?
Well, most of the things that we do are income-based. So as long as you qualify income-wise, you can contact us. And let's just use the example of your transportation is down. You contact us. Even if you can't come into the office right away, you can go to our website, complete an electronic application. From there, someone will contact you, assess your situation, provide you with bus passes if you need them, and direct you to get your car assessed, get your quotes, things going, and we try to get you up and running with 14 to 21 days.
Wow. Okay, that's pretty amazing.
Yeah.
Because I think a lot of people are just distressed about this whole situation of job losses and the lack of money and just feeling there's nowhere to turn to, there's nowhere to go for help.
Right. And all family members of all ages, it affects your seniors, your youth, parents, single people. It's wide-reaching, and so there are so many different problems and a lot of things that people don't even think about outside of the physical virus. The side effects of either having the virus or being threatened by the virus. From mental issues to other physical issues, is really, really deep.
Wow. Now, have you faced that at all in terms of calls from people who are actually going through the disease itself, the virus, experiencing the virus itself and needing help?
Yeah, like I said, we come across all kinds of people who are battling the disease themselves, advocates of those people. We try to assist, every scenario that we can. Yeah.
Wow. Pretty amazing. So, well, the goal of this program, folks, is to let you know that there is help available, there is assistance available, and also to educate you about the various options in the community to help you to overcome those obstacles. And later on, we're going to be talking to a pharmacist who's going to talk about vaccines. Now, you actually, if it's okay for us to say, you had COVID.
I did, and I'm relatively young and healthy, but it is definitely not a joke. So we definitely need to take this disease seriously and do all that we can to combat it.
Okay. So how long did you go through your ordeal?
I was down probably a good 2 to 3 weeks. Yeah, just
really
2 to 3 weeks. Significant deficiency in energy, body aches. The traditional cold and flu symptoms, again, I wouldn't want to wish that on anyone.
Wow.
So yeah, and especially when you have multiple people within an organization battling, it could be a quite big ordeal. So therefore, that's why we all need to come together. We want the information to get out, expose people to the other resources in the community that are available to them.
Okay. Well, we're going to take a break, and when we come back, we're going to talk about getting vaccinated, whether we've had our vaccinations or not, and whether you've gotten yours yet, or we're going to help you get it after this.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
And we're back here on the COVID-19 recovery. And Terrence White from the Community Action of Greater Indianapolis is here with me as well. And Terrence, you know, you've gotten your vaccination, I've gotten mine. And I understand the CDC has issued some new recommendations.
New recommendations, yes, but do the pre-existing precautions, should they still stand? Yes.
Okay.
So, but but CDC is a formidable source. So,
Right.
I mean, some people are going to take those recommendations more serious than others. But I think generally, I think we should. My opinion is we should
stick to the old
stick to the way we've been doing it for a little bit longer.
Okay. Well, we've got an expert with us who can tell you a lot better than Terrence and I can. She is Dr. Katasha Butler with Eskenazi Health, and you are a pharmacist. You have a doctorate in pharmacy. And so tell us, what is the CDC saying to us now that we've gotten our vaccination? Some of us, and of course some of us have not.
Right. So what they have just rolled out is that if you have been vaccinated and you can have small gatherings with other vaccinated individuals, but universal precautions should still be taken. So, making sure that you're washing your hands, keep wearing your mask, especially if you don't know the vaccination status of the individuals that you are around, and making sure that you're social distancing with the 6 feet. If you do not know what the vaccination status is of the people you're around, but they are saying that, you can have small gatherings with people who who are vaccinated, and you don't have to wear your mask.
Okay. Well,
I think, I'm not sure, that's something that I think about all the time. How long, even if we get to, what they call herd immunity, how long will people still feel comfortable, with keeping that mask on? So that's something that's remains to be seen. If we look at other countries, even before this started, a lot of people wore masks all the time anyway in public. So.
Right. That's an interesting point because, like you said, we should keep washing our hands. Weren't we supposed to be washing our hands anyway? So let's just go back to being nasty. Is that what what does that mean, when people say that? So it's not bad advice.
Yeah, we didn't think that we would have to, educate people on general precautions like hand washing, and, sneezing into your elbow, not into the air. And so a lot of things that we probably take for granted, we had to do a whole ramp up and education campaign on. And so we just want to make sure that people continue to do that.
Okay, yeah. Yeah, and I could see social distancing, like at least having that awareness that I don't need somebody too closely to me all my life. I mean, especially because if it's not COVID-19, I don't want a cold if I don't have to get the cold. Exactly. I don't want the flu if I don't have to get the flu. So exactly. I can see this carrying over, and it seems to me that a lot of people didn't have a cold this winter. I don't know anybody who had a cold, And is it the result of, the precautions we took for COVID-19?
Flu, flu illnesses are way down. Cold, the common cold is way down, and those things are highly contagious and, hand to mouth around people. And so that could, have some credence to it. We have been isolated in our own pods with our families. And so, we're not mixing and mingling. And so that could be an effect of why they're way down, because they are certainly way down as compared to previous years.
One of the things
in school, a lot of times children, they bring the cold virus into your home. Just from interacting with other children, it's hard to keep kids from touching and commingling and things like that.
family interaction is very important to a lot of us. In certain communities, that is an integral part of their culture. With the vaccines available now, are you seeing the reluctance of certain communities accepting the virus or willing to take the virus? And if so, from what you've seen, how do you think we could advocate for them to get the vaccination?
Definitely. Of course, I've seen it in, our own community, the African American population. There is a long history of, having some reticence to healthcare, systemic issues in healthcare. We go back thinking about like Henrietta Lacks and the HeLa cells and Tuskegee experiments and things like that. I will not call it irrational. There's a reason why the Black population has hesitance, especially something that is rolled out as quickly as these COVID vaccines. However, I would submit is that we are the population that has higher healthcare disparities. So COVID is going to affect us at a different level, a different acuity than it would some other populations. And so we just don't have the luxury of saying, I just don't trust it and I don't want to take it. It took some convincing of my own parents. My mother was like, whenever it's available, sign me up. My dad, I had to talk to him a little bit about it, but I also think that I lost an uncle to COVID-related illness. And when something like that hits very close to home, then people, are more apt to do what they need to do. He had comorbidities, diabetes, hypertension. And so it just affects us differently at a higher acuity. And we don't want to be left holding the bag on the outside looking in. And so I encourage anyone that I come in contact with, if they ask me a question, please get it. I proudly tell people I've been vaccinated since December. I actually work in what we call the pod down in Eskenazi, the vaccination pod. I'm going down there tomorrow. Anytime I see, I tell the patients when they're signing up for their next shot, I'm so happy to see you here. I'm glad you got vaccinated, because it's just very important for us all to be encouraging for everyone to take up this vaccination, and especially people in the Black community and other underserved populations.
When it comes to understanding the vaccine, can you give us a little bit of context as it relates to live virus being injected into your body versus like current technology, and the difference between right now the three main vaccinations available today?
Right. So the first two vaccines, that is the Pfizer and the Moderna, they use the messenger RNA technology, and that is not putting in a weakened or inactivated disease into your body. It's using that technology to basically create the protein that is going to kick off your body's own immune system to attack the virus. So that one, those first two are not injecting any virus, and it's not changing your DNA. That's a lot of questions that we get, Is it going to change your DNA? No, it is not going to do that. The latest vaccine, which is Johnson and Johnson, and so basically that's the one where they call it a viral vector. So it is some of the virus. It's weak and inactivated, and it again, once it's injected into your body, it carries those spike proteins that activate your body's immune system. And so then your body creates the antibodies. Once those antibodies are produced in your body remembers it. And so if it comes into contact with the coronavirus, either through inhalation, then it remembers, oh, we've already encountered this before, and we know how to combat it. So you don't get as sick if you get sick at all. And so the most important thing to remember is that these viruses are very effective. You may not get the COVID disease, or you may. If you do, you most likely will not be hospitalized, and the symptoms won't be severe where you have to seek medical attention.
So when we talk about, one thing that I'm really cognizant of is when I speak on like the side effects that I've experienced with the vaccine, which was only a sore arm, but and I appreciate that other people have experienced, different ones. One of the things that I try not to do is try to build fear or promote fear, to others. So, they say, well, you got sick. Well, can you explain the difference of an expected side effect or as opposed to creation of sickness?
Right. So those side effects, when I got mine, I had a sore arm. The first shot, the second shot, it was sore, but not as sore. Those are expected. If you can remember getting flu shots or a Tdap, what we call booster shots, if you all can remember back to those times, sometimes you had a sore arm or fatigue or a low fever. Those are benign side effects of getting most vaccinations, including these COVID vaccines. And so if you get those, just depending on the product, depending on your own body, depending on your own immune system, it could be worse for others. Some people don't have any side effects at all. And so, but those are to be expected and not as an excuse to be like, oh, I'm not going to get that. If I got every side effect that was, available when I got the COVID vaccine, I'd rather have that and be down for 12 hours, 24 hours than to get COVID that leads to hospitalization, increased morbidity up to death. So I'd rather deal with those things.
Dr. Butler, one last question before we go. We talked about the new recommendations by the CDC and especially regarding those who are now vaccinated. What about large events and traveling?
So I love to travel. I miss traveling. Sometimes it is essential to travel, especially on airlines and things like that. If you can avoid them, please do. I do know that, the government is relaxing guidelines. They're opening up restaurants, a little bit more capacity. We're getting our spectator events back. March Madness is going on. It's going to be here in Indianapolis. Again, if you decide that, you want to participate in these events, I would do it if I was vaccinated. And even if I was vaccinated, I would still mask up, social distance, and take all of those precautions. As I said before, Indiana has done very well in their measures to keep this pandemic tamped down here in the state. Our numbers are going very well, but in order to keep them moving in that direction, we can't just, open up all at once. We still have to do what we need to do personally to protect ourselves and protect our family. So if you do participate in these events, know that they are not going to be at full capacity, but make sure that you are taking those same precautions if you are participating. And if we keep doing these things, then hopefully we can go back and return to some sense of what we call, our old normal. It will be our new normal, because I'm not sure what that looks like, but we are making steady progress towards that.
Okay, sounds good. Sounds good to me. Well, we appreciate you joining us and all your words of wisdom and advice, and helping our viewers recover.
Thank you so much. As I said, this is very important to me, and I just encourage everyone, once you are eligible, please go and get that vaccination.
All right. Sounds good to me. Dr. Katasha Butler from Eskenazi Health, thanks so much for joining us.
Take care.
And thank you for joining us. I'm Kelly Vaughn.
I'm Terrence White.
And we'll see you next time on COVID-19 Recovery.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Serving Boone, Hamilton, Hendricks, and Marion counties, be sure to visit our website to learn about employment and education opportunities, food, housing, transportation assistance, and more. Apply today by calling 317-396-1800.